Everyone, thank you so much for joining us here on this Thursday morning on the COVID-19 Care Conversation brought to you by the Hawaii Executive Collaborative. Great to see everyone writing in their good mornings. Hi, Ryan. I'm Yunji Denise. Well, I don't hear you.
There we go. Want to thank everyone. Good morning. I'm Ryan Kalei-Suji. Thank you all for tuning in here to the Honolulu Star Advertiser, wherever you may be watching this from. We have a very special guest with us this morning. Lieutenant Governor Josh Green will be joining us in just a few moments. We want to encourage all of you who are tuning in to enter your questions for the Lieutenant Governor. We have a lot of topics to discuss, a lot of things happening here, of course, surrounding COVID-19 here in the state of Hawaii. And there's a lot of things that I know that are on your mind. So we want to make sure that we can get to as many questions as we can. First off, though, we'd like to start off with the count of sort of where we're at. And Yunji, the numbers continue to go down.
Yeah, it's really good to see. We see this leveling off, and we're going to be talking to Dr. Green about that. 13 new cases for a total of 530 positive since the outbreak began here in Hawaii. Some good news, though. 359 patients here in Hawaii have recovered since the start of the outbreak. So that is really good to see the recoveries increasing and, you know, the daily totals, not those numbers that we were seeing for a while, but single digits and then lower double digits. So that's good to see. However, today, one of the big headlines in the Star Advertiser, Hawaii officials investigating half a dozen coronavirus clusters. So that is something that needs further attention for sure. Investigations include employees at Wahiawa Health, more than 30 cases at Maui Memorial Medical Center, and then a dozen cases connected to 2 McDonald's locations in Kailua Kona on Hawaii Island. So some concerning news there. The other thing, of course, when we're talking about coronavirus is unemployment. Some people finally starting to see some relief.
Oh, that's right. We're getting word that some of those checks starting to make its way through the federal CARES package that was passed. But we also are hearing, we got an update yesterday from Scott Murakami from the Department of Labor. And it was reported Wednesday that it issued $11.2 million in payouts last week to the unemployment workers. That's up from $4.1 million in each year of the 2 years, 2 weeks, and $2.9 million in each of the first 3 weeks of March. So a lot of money being handed out. Of course, there's a lot of people out of work, and that's another thing that we want to talk to Lieutenant Governor Green about. In fact, we actually want to bring him in to the conversation to talk a little more about not only the unemployment, but of course the cases that are happening. And joining us now is Lieutenant Governor Josh Green. Lieutenant Governor, thank you so much for joining us. First off, let's start off with just the overall count. We're seeing the numbers continue to go down, the flattening of the curve, if you will. So you have to be encouraged by those numbers. But I guess the next question is, now what? What's the next steps in terms of trying to figure out where we go from here?
Well, perfect question. Thank you, Ryan, Yunji. Very, very appreciative of being able to share this with you. So as Yunji said, we had just 13 new cases yesterday and 13 the day before. And I can report right now we have 11 new cases today total. So it's really been, knock wood, a flat curve. It's completely gone like this, okay? And that's exactly what you want. This is the physician in mind that I want to say, when you have a flat curve like that, we don't see a spike and don't overutilize our intensive care unit and our ventilators. So that's incredibly valuable. So great kudos to all the people out there that are sacrificing, staying at home, isolating at home. That is absolutely working. We got 2 weeks left with the home quarantine. Continue. Do not get overconfident. Keep doing it. And then what comes next, you ask? Well, what comes next is a very deliberate, cautious opening up of our normal behavior. We will still likely have to social distance for some time. As you see an increase in the number of people that have recovered, so they're not infectious any longer, and we still have a lockdown on travel to the state of Hawaii, we essentially can have no cases or very few cases in our midst. If people then still socially distance 6 feet away from one another, I'm going to continue to recommend people wear masks no matter what when they're outdoors, unless they're, exercising or, surfing away from people. If we do those things, we can gradually start the restaurants again. We can gradually start going to hike again where there are more people. We can gradually start doing all those regular things that we do because the risk of spread will be very low. And then I'm sure you're going to want to have some time discussing when do we bring travelers back, the lifeblood of our economy. Well, I've already put together a plan which is being reviewed, and this is just the first draft of it, but a plan which will mandate that people get clearance that they are negative for COVID-19 before they come to Hawaii. Not unlike the process we do when we have to assure other diseases don't come. And I'm not trying to be clever or glib about this, but we had very strong rules, still do, about our pets and rabies, for instance. We know we go through that process to make sure our pets don't have rabies. You get a bunch of checks, and so we've never had rabies in the state of Hawaii. Well, something similar, much more simple, about a check to make sure people do not have COVID-19, we'll be able to prepare ourselves for a very, very low number of risk individuals that visit us. That's the kind of process that we'll do, and we'll begin to build our lives and our economy back.
How would that actually work? Is there going to be some kind of a national standard where like our kids go to school and they have a vaccination card? Is there going to be some kind of, because how will we know that these tests are verified? Is there, it's hard for me to envision how that actually plays out.
Right. So I'm writing that standard actually for us, and I'll share it. I've already shared it with the CDC as well. What it will be a verified FDA approved test, which we use here in Hawaii. My recommendation, at least at first blush, will be 72 hours out. You don't, you make sure that everyone's had a test that's negative or some such number. That's in the window, of course, when people would be asymptomatic. Then you get a temperature check at an airport, and we check them also before they come and when they get here. That will give us a very high level of security that, number one, a person is negative with a verified test, not some kind of whimsical test, a verified test by a healthcare provider, and they have a certificate. If anybody does show up without that certificate, that's when we utilize some of the rapid tests that we have, something quick. Otherwise, if we want to take no risk, we would put people into quarantine or send them home. So that is a way for us to do it. And as the leadership looks over this proposal, that will help us, because then we will not have to have extended quarantine. By then, there will be some immunity out there. I can't say when this will start, but I can say that we should not reopen our islands to large numbers of travelers until we have that in place, because we're only a matter of time until the vaccine comes, right? It's always between, well, not always, the best number is between 9 and 18 months. There are outside possibilities of getting it this fall. More likely it'll be early next year, but once we're vaccinated, then really we're pretty much in the clear, right? So this would be a temporary measure, and let's be frank, 2020 is going to be a pretty slow year for our economy. It's going to be rough going. But with that kind of precaution, we will not see large spikes, because I don't want to beat this virus the first time with a flat curve and then sometime in August, September, October, see a crazy surge because people travel from around the world and bring it here.
Dr. Christina Kishimoto was on yesterday, and she was talking about the state moving ahead, her department moving ahead with summer school planning. Given what you're telling us, do you think that that's realistic, that the kids can go back in summer?
Well, right now, if we have very good control like we do, and we have very good control, again, I'm kind of superstitious, I'm knocking wood because I don't want to jinx this, right? We get to the end of April, we will still track everything through the month of May. And when summer school time comes, if we have virtually no active disease, then Christina is right on the mark. It will be low risk, because we will be able to have essentially knocked it down or eradicated the disease in state. Now, as people come in, we're going to want to make sure that they're negative, so we're not introducing any disease. We'll also be continuously assessing, testing, and doing kind of our contact tracing and testing around clusters as we go. So we could get to a place like that. But I do leave the decisions about the schools to Dr. Kishimoto and then, of course, the Gov. That's important that we leave people in their areas of expertise to make those decisions.
So I want to go back to your proposal for the testing that happens through. So essentially, anyone that comes into the state would have to get this test done. Do you think realistically that there's going to be that option for people to get tests, seeing now as how people are struggling to get the tests now here in the United States alone, just the availability of the test? How realistic is it going to be to ask everybody that wants to come here to get a test, even if they're not showing any symptoms at all?
Well, it'll be a choice people make. And there are more and more tests. What happens in a crisis like this is the private sector ramps up like crazy. And so once the epidemic has basically died down, we're not going to want to open up anyway in the throes of the epidemic. Once it's died down, there's going to be a lot of extra PPE around. There's going to be a lot of extra tests around. Yesterday, they approved the swab in the cheek, which is a very simple test over on the mainland in New Jersey. So there's going to be a lot of new options for testing. And if they're FDA approved and they are reliable, it shouldn't be that difficult. Also, there's going to be a lot more a lot more antigen tests that are rapid tests. Abbott's going to be sending out a lot of these machines, and it's going to become much more available in regular doctors' offices in the coming months, in little clinics, in walk-in places. This is going to become one of the standards nationwide for travel for a period of time because so much fear is associated with coronavirus. So I do think it's realistic. Obviously, this is going to be up to debate, and I will say this. Normally, we get about, under normal circumstances, 700,000 or 800,000 visitors per month, right? There's no way on earth we could have 700,000 people come to the state of Hawaii in a month where there's still hot spots around the world with COVID. That would be like landing cruise ships in every part of the state at all times, wondering whether people are positive. There's no way that's happening. So there will have to be some standards. Now, there are going to be other tests too. The antibody tests are being developed. Antibody tests, I was just on the phone with the deputy director of the CDC nationally, and he was able to share with me that the antibody tests are ramping up very quickly. Now, the antibody tests are different than those 3-hour tests or that take several days when you send them out. An antibody test is just a quick prick of the finger, a drop of blood, and that test itself can tell you whether you've had the antibodies and have become immune to a disease, in this case, COVID-19. As those tests get refined, and there are right now 70 companies, 70, that are working on tests in the United States alone, that's going to be a very easy way to assess whether people have immunity. So that immunity can be extremely valuable as a tool for us. Imagine if we were able to then just have a quick test, which takes 90 seconds to see whether or not somebody already has antibodies, so they're not at risk. So these are some things that are going to happen very quickly. And to be frank, I think that the market is going to meet the need because people are going to want to travel to Hawaii. We just don't want them to come here if they can spread infection and kill our kupuna.
Well, you are giving me hope because all of these things sound like there's a light at the end of the tunnel, that there is a way out of this when often it feels like there's not. I wonder if you think the statewide stay-at-home order will be in place beyond April 30th.
I'd say it's a coin toss right now. I think there could be a limited extension. I can't speak to that today on live camera, and I think that is being discussed very actively. I do know that some parts of the mainland, they have extended some of their stay-at-homes till May 15th, but we're doing very well. And if we do lift the stay-at-home, I think the right thing to do would be to lift it with some caveats. And those caveats should be obviously that we still have masks for people, that we still do social distancing, and that we still, basically, that we don't go back to our old ways. That's the most important thing. Sorry, an itch. Sorry about that. Yeah.
Well, okay.
And that's the way to go. I mean, really, I don't think we're not looking at a several-month stay-at-home. There's no way people can tolerate that. We'd have more people going bonkers in their house and wanting to kill their spouses, which is a tragedy. I mean, you can't have people fighting at home. You have to get out a little bit. And so we have to really, really, really take into consideration our economic needs, most importantly, our social needs. And all of that comes after survival, but we're surviving pretty well right now. We've had 9 fatalities, which is heartbreaking. Keep in mind, we did have 60 to 80 fatalities from flu every year for the last decade. So flu has been, to this point, more lethal than coronavirus for Hawaii.
Let's get to the other headline that a lot of people are writing in about, a lot of people have questions about, and that is the state budget shortfall. We are looking down. I think the governor, I want to make sure I got the number right. He said the state is facing an emergency, likely needing to cut spending by $1.5 billion. A lot of controversy over his proposal to cut state workers and some frontline workers between 10 and 20% of those salaries. What's your take on that?
Well, that's a great question. So, a couple things. First of all, that $1.5 billion is not just this year. It goes through these last 2 months of this fiscal year, which are going to be well, actually April, May, June, right? And then the whole next year. So, we're looking at about a $200 million shortfall between now and June 30th. That was just a discussion point. That was not actually a proposal that had come from the governor, which I can say clearly. And so, in these kind of discussions, people, of course, talk, and that's what happened. I know that the governor probably would have preferred that those conversations stayed private through the course of a whole discussion. There are possibilities that we can use other resources, and these are the other discussions that are happening. Do we use some of the rainy day fund? As of now, there's $388 million in the rainy day fund available. There's also $178 million in the hurricane relief fund, which we have used before during crises as long as we guaranteed to replenish it. So it does stand to reason that we will look very carefully at those funds and some of the special funds that are not historically used before we extract blood from hardworking people. Now, I will say this: if we make any cuts, cut me first. Okay, that's obvious, but that's not a solution, right? So I think what really has to happen is over these next few weeks, a very, very candid discussion will occur between leadership of the Senate, the House, the governor, and the public employee unions to see what we're really looking at. It would be preferable if there was at least a very modest cut for the executives, and then looking at over time what we really need to cut when we start seeing what the revenue projections are over the next few months. I don't think that we have to cut precipitously or right away. I do have to defer to the governor. There is a pretty distinct difference between lieutenant governors. We get to say whatever we want, and then the governor has to do whatever is going to be financially possible. I think that it won't be as bad as what was leaked. I think there will definitely be a lot more consideration, and I think probably we have to treat everyone equally. I don't think it would be fair to cut one group more than another.
Yeah, and I think that is sort of the discussion that's happening too online and through the community, is that there are people in the private sector that are saying, hey, look, we've gotten furloughed, we've gotten pay cuts, we've gotten laid off. Why shouldn't state employees suffer the same? So it's causing a little bit of a divide in the community, and something that obviously will have to be made. A decision will have to be made on how that moves forward as well. In sort of relation to that, your thoughts on the unemployment numbers that continue to rise and the state's ability to fill that gap, knowing that this could potentially add to the unemployment numbers and those filing for claims if they see a reduction in pay?
I think that's very relevant. In fact, one of the reasons that I'd prefer to see no reduction in pay, if possible, through June 30th, if that's possible, is because I'd like to see us get through this real rough spot. Because if we continue to do this well on the virus, we will be able to see significant travel begin. It's not going to be 100%, but it will be very significant come July, when people are out of school, when they have a desire after 6 months of tragedy to travel to places like Hawaii. And if we can do it in a streamlined way, bring people here safely, it would be very terrific to be able to have those people still employed at hotels and restaurants and in so many different industries. Also, we could start, although there'll be a little delay, a little lag, seeing exactly what the revenues look like with the shutdown and the modest opening. It would likely be very preferable to use some rainy day funds, because it is raining. I mean, let's be honest, it's raining virus right now, but it's raining nonetheless. And if we could do that instead, way better. There is a mandate that we have to balance the budget. So at the end of the day, any governor is going to have to do that. So these are some big decisions, and those numbers have to be done with great clarity. And I guess people got a quick glimpse into the early thinking, more than I suppose is usual.
We also want to take time to bring in some questions from those who are tuning in. Dini's asking about how strict are we with homeless coming in from the mainland to Hawaii? We know that there have been some that have already been sent back because they could not provide a place where they're staying. What efforts are being made to ensure that that continues with all the visitors that are coming in?
Yeah, they're going back. I had to travel Inter Island for one of my ER shifts last weekend, and I can tell you the airport's in total lockdown with the National Guard and TSA. If you're homeless and someone shows up here, they're going back, because we are already struggling to get enough services for the homeless in general. And then, of course, we're deathly afraid of an outbreak in the homeless community. And if that happens, it could be quite bad. That's why we started the Ka'ahi facility just down in Iwilei, why we're providing extra services to people and why we're testing people as needed if there's any concern. We take people over to Queens very quickly in the urban core and get them tested if we think that they're at risk. If anyone's homeless and flies in here, they're going back. And this actually could set some precedents because it's better for people to be with their home and family cohort than to be in Hawaii in presumed paradise without any resource.
I see a lot of questions also about the testing that you were talking about. What kind of time frame are we looking about for those antibody tests to be available or that rapid testing to be available?
Well, rapid testing's already here. We already have 15 of the Abbott machines. It's going on daily. So if we can get a lot of them, which I would hope we will, and have some available at the airport as needed, we're good. But they are totally legit and activated and so on. The antibody tests, I know of at least 3 different physicians that are using them actively right now as small test cases to test against their positive cases. So we're getting some samples and testing right here. Also, like I mentioned earlier, the CDC is doing it, and those other 70 companies are working as fast as they can to get some clarity on whether or not their data is good. The important thing that the Department of Health would actually tell you is when you do these rapid tests, you want to make sure that they're both sensitive and specific. Sensitive meaning they pick up any coronavirus, and then specific that they pick up a coronavirus that's this one. And so they have to be pretty good. You want to get at least high 80% to the 90 percentile reliability on these tests in order to use them. But they're available now. We could use them, but they're not perfect yet.
We're also seeing questions, and I know that this has been a concern of yours as well, about visitors that continue to come into the state that are arriving and that are supposedly going to that 14-day quarantine. What are some of the things that you would suggest to maybe limit those numbers? Are you in favor of having a specific hotel or location where these people would quarantine at, and how would that look like? What would be your sort of recommendation for these numbers that continue to seemingly grow?
Yeah, I actually think they should be at one designated hotel if they come in here. So if they were to come through and maybe people were unaware that there was a mandatory 14-day quarantine. I mean, some people come from other countries and amazingly don't know exactly what they're dealing with. Then we put them in one hotel where there's a resort where people can maybe be together and they don't literally have to be in their room for 24/7, but they cannot go off grounds. That would be helpful. We are limiting what people are doing outside pretty significantly. I mean, there's a lot of citations that happen. The National Guard is out a little bit. We have reduced things very greatly, but it should be zero. There should be no outside travelers coming here. I think as early as, I want to say March 18th, I called for an end to all non-essential travel. It turns out legally only the president can block travel into a state, which we respect that. The federal difference between federal and state laws is relevant. However, our Department of Health has the prerogative to monitor and self-quarantine in a time of crisis, and we are in one. So that's how I do it.
Can we going back to the unemployment benefits? I know a lot of people are really frustrated. There is also something in the paper today that says that the state could actually run out of money to fund those unemployment benefits sometime in May, and then would have to take a loan from the federal government to fulfill those needs. I mean, just the sheer number, can you talk about, people calling that 800 number every day when we do this live stream? They say, I'm calling, I'm not getting anywhere with these benefits. What more can be done to alleviate that backlog? Obviously, that system's not designed for 200,000 plus people at the same time, but people are obviously hurting.
Yes, people are hurting, and it hurts me to see it. So we did increase the number of call lines and websites and email lines that people can do. So they're working as fast as they possibly can. And I know how frustrating it is. I do. I mean, we even saw an emotional response from our labor director because he's working so hard. He got another $2 million out just in the last few hours. I was just alerted. But there are tens of thousands of people that are in trouble. We're going to catch up with that, and we're going to be generous, and we're going to make sure the state has the money. The good news is we can borrow money at an all-time low rate, which is relevant. And there's going to be continued stimulus packages, in my opinion, that will help with these things. That's one of the other reasons I'd like to get us to June 30th, if we could, without any significant cuts, furloughs, describe them how you will, for workers, not too deep, because I don't want people going onto the unemployment rolls and I'd rather have people work for their money, basically, than get free money, if I can be just that direct. And then in addition to that, I want to support our businesses so they can continue to hire people back. Because yeah, the private sector, which employs more people than anybody, deserves to have some support. We know we ran out of small business loan money after 13 days. That's also going to have another injection of money. This is something like we've never seen before in our country, even with the crash in 2008 or the previous outbreak or 9/11. All of those things were finite in their own way. This issue is going to go on for several months, if not more than a year, depending on the trajectory of the virus. So we're going to have to continue to put money into those funds, and Hawaii will recover much more quickly than anywhere else. I'll tell you that. As soon as we have a mechanism to bring people into the state, hotels are they're going to go crazy to open again.
All right, and we know that we're running out of time, but I just have one more question that I want to get, just so that we can get some viewer question in here, and this may be a simple one for you to answer. Is there any evidence of food transmission that has happened from the coronavirus? Any passing of the virus through food or anything? Because we know that there's been reports that it can live on plastics, it can live on the surfaces, but food directly, do you know anything or have you heard anything about that?
Correct. Good question. There has not been evidence to my knowledge, of any food transmission. When it's mostly all droplets and through the mucous membranes in the nose, eyes, and mouth, but that's into the membranes itself. When you eat, you have all of the enzymes and the gastric content to break down viruses. Now, there has been transmission at food establishments, like you saw at the McDonald's on Big Island, but that's between individuals. That's because they were shedding the virus because they were sick. They spread it to their coworkers. I don't believe they spread any of the virus to patrons of McDonald's. So, it's scary because we learn a lot every day. It's only been a disease that we've had around for 100 days or so, and so we're learning things quite quickly. The big things we learned were how long people were infectious, how long it took before people became infectious and symptomatic. We've learned quite a lot about the testing and the reliability, and we've learned that stay-at-home orders and masks really work. We learned that from Asia. So we do those things, and then we test very rigorously around symptomatic people and close contacts. You do those things, and you can beat this without too much. It's not rocket science, in other words, once you do that. But that's what we have to do, and I'm putting together as much in the way of capacity to do those three things as possible. And if we do that with a little bit of testing and strategic capacity, we can get our economy going back quite nicely by this fall.
Okay, I know that last question, I know that you spoke a little bit, I know Ryan said he was last, but I'll be last. I know you spoke a little bit about just the stress that people are feeling. They might be having trouble at home. I mean, it's a lot to be locked in with your family. It's been 3 weeks now for the statewide lockdown. What do you say to people? I know every day I see you with that whiteboard saying, stay the course. It feels like we are at a tipping point and we really could get there.
Yes, we can get there. It's kind of like we're coming down through the last third of the marathon, which has been essentially a 40-day marathon, and we got 14 days left. Just don't give up. Finish this marathon. Finish this marathon, because if we all do this together, then there's no extension of the finish line. We don't add another 10 miles onto a 26-mile race. Don't put ourselves in that position. And we haven't had to do other things, which people haven't talked much about. We have not had to militarize this response, which a lot of countries would have had to do and have done. We've been able to do it peacefully as partners and as one Ohana, and that is really good. So guys, go out for nice long walks, take a mask in case you encounter anybody, stay 6 feet away from other people or more. Do those things, get some stress relief, just love each other, but understand that you really are in the last third of this marathon, and this will be a truly phenomenal achievement if we continue to see this through to its end and stop this virus without killing large numbers of our kupuna and other loved ones. So you're doing great. People are amazing in their response so far. Stay at home and isolate. Stay 6 feet apart. Wear masks when you're out. And 14 days will pass pretty quickly. I know you're getting tired of watching Tiger King and other shows. Nobody can watch Walking Dead because it's just too close to home. Okay, I get it, but watch your favorite shows, hug each other, take long naps, take long walks, and we'll get through this and we'll be okay.
I don't know if anyone's getting tired of watching Tiger King. It's pretty entertaining.
Tiger King is pretty good. My aunt sent me a shirt with tigers on it just because she's crazy. And
There you go.
you know.
Thank you so much, Lieutenant Governor
Yeah.
Josh Green. Thank you so much for spending so much of your morning with us. We really appreciate it. We hope to check in with you in the next week or two.
I'll be around.
Thank you. Aloha.
Yeah. Okay, and interesting there, if you missed the top of the broadcast, at the end of this, obviously we shut down and then you can go back and watch it. You can't watch the beginning while we're still streaming, but a couple of things that he said that we do want to make sure that you get in case you missed. The new count for today, 11 new cases. Yesterday was 13, so today 11. So we are seeing that flattening. That is very encouraging. And an interesting proposal he had for how to open up our tourism economy again. Mandating some kind of verified testing. Ryan, I haven't heard that before, so that's something that he said that he's proposing. It'll be interesting to see how the mechanics of that actually play out.
Yeah, and I think there were a lot of questions too also that came in about who pays for that, how realistic is it, the time frame wise. I think there are still a lot of questions, maybe more questions than answers at this point in time, but he's saying in an ideal world, there would be that 72-hour testing that would happen before people arrive here in the state, making sure that they are required to have that testing and that sort of a card that says that they have passed it. And if they hadn't, then they would get tested here. So there's a lot of mechanics that would have to go in place there, as well as the personnel that would have to be set up in place here locally to receive. All that to say, I think we are a long ways away from having the state open up for an automatic open for business with the tourism industry being at full throttle again. I think it's very clear that there are a lot of things that still need to be figured out on that end.
Yeah, and then back on the issue that's gotten so many comments, the issue of cutting state workers' pay, including first responders and then teachers. He said that was information that came out of a discussion that the governor and other state officials were having with some of the union leaderships, and that is not actually on the table quite yet. It's sort of a situation where everything's on the table because they are staring down the barrel at hundreds of millions of dollars lost in state tax revenue. But he's saying that, they're looking at everything. They're looking at the rainy day fund. They're looking at the hurricane fund. And that is still an ongoing discussion that is not a foregone conclusion. So it's important for everyone to sort of take a step back. And he did say that the administration is going to be very transparent about how they are making cuts and that executives would be cut first.
Yeah, and again, it is very preliminary. And he actually said that it was a discussion that he wishes hadn't had gone public because it was just sort of everything was on the table and they're looking at every possible option, including those cuts. But it has to come from somewhere. I think you're looking at the bottom line. The state has to balance the budget, and cuts will have to be made because of the the lack of funding that is coming in from taxes and, of course, from the tourism industry. So a great conversation. Make sure to go back and watch it again. And we will actually have the governor here on Monday to talk a little bit more about those cuts and those problems coming up next week, as well as Senate President Ron Kochi will also be on, so we can get his take on those cuts as well.
Yeah, we know that a lot of you are looking forward to that. Tomorrow, we've got a great guest. We're going to be talking to a marriage and family therapist. The lieutenant governor did make mention of how stressed we all are. And so we want to take a step back from, we've had a lot of political guests on and take a step away from that and really talk about self-care as we head into the weekend, how we can continue to try to get along with each other at home and what to do if you are getting overwhelmed. So that's going to be tomorrow. Before we go, though, we want to tell you about a few other big headlines. There is enforcement happening across the state, including on the Big Island. On the Hawaii Island police have actually arrested 17 people and cited 77 others for violating the stay-at-home order between April 8th and yesterday. So those are people who are now facing either a $5,000 fine or up to a year in jail. So remember, no matter what island you are on, this is a statewide order. Stay at home unless you're out for essential business, because you do risk the risk of being cited, booked, all of that, having a criminal record, and none of us want to add that kind of stress. Okay, now to some happy news, our Hawaii hero, Ryan.
That's right. We have a number of people who are stepping up in the community. One of those organizations that are doing just that is the Salvation Army. And the photo that you see here, this is Salvation Army at the Kroc Center, where staff members on Wednesday distributed 495 produce bags, 560 trays of eggs, and 550 gallons of milk, and 115 bags of non-perishable items donated by local companies to nearly 600 families in need. So They partnered with Aloha Harvest, Eggs Hawaii, and HFA, Cisco Hawaii, and Metal Gold Hawaii to provide those donations. So Salvation Army, we also saw it at Ala Moana Center, where they had a large number of people also lining up to get those food packages. So Salvation Armies are Hawaii Hero, one of the many organizations that are doing all that they can to help provide support during this time.
Yeah, and we also want to tell you about an article in today's paper for those of you who may be diabetes patients. Three major insulin makers are now offering resources to help patients: Eli Lilly, Sanofi, and Novo Nordisk. That information is all in that article. You can find out how you can get your medication at a reduced price or even free. We know that insulin can be very expensive, so if you are diabetic, or if there's someone in your family who needs insulin, check out that article today so you can find out how to apply for those resources.
And another thing, we also really want to remind you that the mask ruling or the order that was put in place by the city goes into effect next week, Monday. So we want to encourage all of you who may need access to a mask, please check out Everyone Hawaii. They are actually still accepting signups or registration, if you will, for those people who are looking for masks. So if you visit their website, Everyone Hawaii, they will make sure to get that over to you.
Yeah, so if you need a free mask, check them out. We really appreciate the discussion. We read all of the comments, and, I know a lot of people are frustrated, and that's why we continue to bring these leaders on. We try to ask as many of your questions as we can, devoting a half hour or more. Again, tomorrow we have a marriage and family therapist on, so please join us for that. Let's all figure out how to ease some of the burden of this stress. And then Monday we've got the governor, and we've got a full week of guests, and we'll tell you about that more tomorrow.
All right, until tomorrow, we'll see you and stay safe. Aloha.